Hey there, welcome to another episode. This is Coach Troy with Tate Fitness, and due to some message requests, they wanted me to do a Winstrol video. So you know what? I'm gonna make a Winstrol video. So this video is about Winstrol, also known as Stanozolol. That's the drug name. So a little brief on Winstrol. What is Winstrol? Well, it's an androgenic anabolic steroid, and it's a DHT derivative. So it's in the dihydrotestosterone family of group of steroids. And I've mentioned on the family tree, the dihydrotestosterone family tree as far as those DHT derivatives, testosterone derivatives, and 19-OR derivatives. Well, we're going back to the DHT derivatives, which is Winstrol, a cutting drug, known as a cutting drug, a drying out agent, I should say, in the terms for bodybuilding. Winstrol also is definitely one of the most popular steroids in the world and in the US, next to Dianabol and say Anavar. But it's right up there amongst those two compounds for sure. And just like Dianabol and Anavar, it's a C17 methyl alkylated drug taken in the oral form. But Winstrol is also administered in the injectable form, which is the veterinary drug Winstrol V for veterinary, into intramuscular. So it kind of bypasses first pass in that aspect because it's not methylated. It doesn't go through the methylation system being processed, skipping first pass, going to the liver and the kidneys and creating all the surplus of pros and cons in there. Now a little history on Stanozolol or Winstrol. It was first described in 1959 in the US market and then put out to market in 1962 by Winthrop Labs and Sterling Drugs. It was, like I said, introduced into the US market for human consumption. And like I also mentioned earlier, it was also used for veterinary purpose, called Winnie V or Winstrol V, for a veterinary compound for animals. But in 1984, they discontinued Winstrol on the market. Now we'll go on some medical terms or medical uses for Winstrol. It was mainly used for medical angioedema, meaning swelling of the lower limbs, swelling of the feet or constant swelling of the feet would be the angioedema. For muscle mass or loss of muscle mass, so for post-operative purposes or post-operative basically delegations for those kinds of patients. For post-corticosteroid use, they use Winstrol for that matter. Osteoporosis in women and postmenopausal women. For cancer patients, to help them with their cancer. For cachexia, so people that are in cachectic states or muscle wasting states. They also use it for an appetite stimulant, so to increase appetite, for appetite stimulation, and that would help for muscle hypertrophy, for the increased appetite for the muscle progress. Now we'll go on to some of the pharmacology and chemical structure of Winstrol or Stanozolol. Like I mentioned earlier, it's a C17A methyl alkylated steroid, because it goes through that methyl alkylation as far as how it digests through the system, skipping first pass. It also has a pyrazole in the A ring, in the nucleus of the A ring, which makes it pretty much unique. And it's not a substrate for 5-alpha reductase because it's already 5-alpha reduced due to already being a DHT derivative steroid. Most DHT derivatives, or I should say all DHT derivatives, are already 5-alpha reduced. So it's no different than Winstrol because it being a 5-alpha reduced steroid already. There's no aromatase, meaning very little estrogen or estrogenicity due to that component, it already being aromatized. Stanozolol or Winstrol is also an agonist to the androgen receptor, so it really binds to that androgen receptor in that sense. It's known to be noted as 3 times stronger than testosterone as far as anabolic to androgenic ratios. So it's highly anabolic and less androgenic even though really, truly, there is some androgenicity that comes with Winstrol, which we'll get into here in a little bit. And it suppresses and binds the sex hormone binding globin. So it really helps and drops that SHBG, sex hormone binding globin, suppresses it, and does help raise free testosterone in candidates that take it. So they get that feeling, that well-being sense of feeling because of higher free testosterone levels. But honestly, if you're having a very high sex hormone binding globin, would it be genetic or just the way your body is or through your environmental stress or whatever it is that you're going through, you're only putting a Band-Aid on this by taking the Winstrol to suppress sex hormone binding globin. Anavar also does the same thing, suppresses SHBG. So does other oral steroids, suppressing it. But again, you're not looking at the big picture here. You're putting a temporary fix in freeing up some of those free-form testosterone from your total, and one of these days your body's gonna fucking crash. It's gonna crash really hard when you're not suppressing your SHBG, and it's gonna skyrocket up, and you're not gonna get hardly any bang for your buck, so to speak. You're not gonna get any kind of free testosterone from your total. Now we'll go on to some of the side effects. It's really harsh on the joints, really hard on the joints. People get achy joints. Again, like I said, it doesn't aromatize because it's already 5-alpha reduced steroid. It is androgenic, so you do have androgenicity components with this. It can cause, if you use it for a long time, and obviously genetic predisposition and translation of the drug is really important, but people who use Winstrol year-round or for 6 months or 12 months at a time, which is really idiotic in my opinion, you're gonna suppress your hypothalamus, okay? There is gonna be suppression. In fact, by day 7, day 14, half your testosterone nanograms per deciliter is gonna be suppressed, it's gonna be cut in half. You keep going and going with it, what's gonna happen? You're gonna have total suppression of your hypothalamus pituitary testicular axis, causing suppression to your testes for producing luteinizing hormone and follicle stimulating hormone. You're gonna be shut down, you're gonna be suppressed. So this steroid will cause ASIH, anabolic steroid-induced hypogonadism. It's inevitable, it's going to happen, okay? I don't give a fuck or give a care who you are. You're not infallible when taking this compound, okay? Anavar for a long time, Winstrol for a long time. Combination of the two, one by itself, for months and months on end, will cause suppression and facilitate suppression and numb the neural function of the pituitary, kind of put it to sleep, so to speak, okay, and cause these negative downstream side effects of anabolic steroid-induced hypogonadism and suppression of the hypothalamus pituitary testicular axis. It's going to happen. I'm sorry to say. It's going to affect the nervous system, okay? It's going to affect how the body biologically functions or should function. And if you put that pituitary to sleep for a long, long time, it won't wake back up. In other words, you'll be suppressed for, I won't say life, because I don't want to be like scaring everybody out there, but it can happen, okay? I'm not saying it can't happen. If you're a candidate for suppression, more so than say somebody else, because you're never going to know what's going to happen, you're going to screw yourself that way, okay? So this is not an oral component that you can just take year-round, crushing your estrogen, suppressing your, like I said, your hypothalamus, or your pituitary gland, your testicular axis, and hope that you'll be okay and do a PCT and do some human chorionic gonadotropin or gonadotropin and hope everything bounces back up. Some people can bounce back from this and reconnect their pituitary and wake it back up. Some not going to wake it back up. You're going to be hypogonadal. You'll have to be on HRT for the rest of your life, and take testosterone therapy. Some people are lucky, some people aren't. So anyways, the roll of the dice, you kind of see what I'm trying to say, okay? Winstrol can also cause soft tissue damage, okay? So it can cause damage in your tissue, can cause damage to your nerve endings, to your tissue, to where you can't get nerve function back in your tissue. It doesn't happen to everybody, but it happens to some people. So I'm just putting that pre-warning out there. And for some people, because of it being liver toxic and hepatotoxic, and skipping first pass, especially in the OR component, due to it being a C17 methyl alkylated steroid, it's going to cause damage to the endothelial lining of the arteries, okay? And building plaque buildup. And if you damage those arteries for a long-term use, and you keep damaging them, you can also cause LVH, left ventricular hypertrophy, of the heart. So again, worst case scenario on all these things, okay? I'm not saying it's going to happen, but it has happened to certain people who have taken this drug for way, way, way too freaking long, okay? So you're not Superman or Superwoman, okay? So I'm talking to women out there too. Be careful, long-term use of any of these drugs. You gotta come off. I would not condone any athlete out there to take an oral component like this for months and months and months on end. I can see people doing a pre-contact, and I'm not advocating anybody to take Winstrol or any of these drugs, but because I'm not a medical doctor, but I can see a competitor taking it for pre-contest for a few weeks or 10 weeks or 12 at the most, or that's a long time to be on Winstrol, but 6 weeks out, and then come off it and taper off, okay? You don't be on it for 12 months straight, or 2 years straight, 3 years straight. You're freaking crazy, okay? That's just my opinion. About side effects, there's the positive effects is lean muscle mass gains, strength gains, strength inertia for that strength performance training vector pre-workout. So there is benefits in putting on muscle with this thing, okay? And hardening up the muscle and leaning out the muscle and getting that dry, lean, grainy look, for pre-contest, because it works well. Don't get me wrong, the drug works, okay? You will get stronger, you will get leaner, you'll get more cross-striated along with the diet and cardio and all these other multifactorial things that's going on, because the Winstrol by itself ain't gonna do it for you. But the side effects, like I said, all these streams of side effects, the androgenicity, the hepatotoxicity, liver toxicity, these things can happen too. So anyways, like I said, you can contact me in the email below, or the Instagram. Please leave comments, and thank you very much for watching this video, and I'll talk to you guys soon. Take care. Thank you. Bye-bye.